Hello and welcome to BSSH Hand Surgery University Challenge. My name is Zaf Nakwi and I will be hosting our very own tribute to the nation's favourite quiz show as the BSSH Diplomats take on the dons of hand surgery. The Diplomats, with an average age of 40, have been practicing medicine for a combined 69 years. Their team consists of graduates from New Delhi, Oxford, Aberdeen and Edinburgh. All have passed the BSSH Hand Surgery Diploma. Will they have enough to take on the might of the dons? Let's meet the Diplomats.
Hello, my name is Ian McGraw. I'm from Glasgow and I work as a consultant orthopaedic hand surgeon at the Royal Alexandra Hospital in Paisley.
Hello, my name is Kate Brown. I'm from Sheffield and I work as a consultant orthopaedic hand surgeon at the Paul Taft unit at the Royal Derby Hospital.
And their captain?
And hello, my name is Anuj Mishra. I'm a plastic and hand surgery consultant. I'm from New Delhi and I represent Manchester Hand Centre.
Hello, my name is Wee Lam. I'm from Singapore. I'm a consultant plastic surgeon in Edinburgh.
Let's meet the dons of hand surgery. The dons, with an average age of 61, have been practicing medicine for a combined 150 years, with graduates from Bristol, St Andrews, Cardiff, and Charing Cross. Surely the problems for the dons will not be agreeing with the answer, not even agreeing with the question, but agreeing amongst each other. Let's meet the dons.
Hello, I'm Donald Sammett. I'm a hand surgeon in Bath in London.
And their captain?
I'm Geoffrey Hooper, a retired hand surgeon from Edinburgh.
Hello, my name is Tim Davis. I am from Nottingham and I work as a consultant hand surgeon.
Hello, my name is Jill Smith. I'm from London and I work as a consultant orthoplastic surgeon in Chelsea and Westminster Hospital, Great Ormond Street Hospital and sometimes up in Edinburgh as well.
Okay, so before we start, a personal disclaimer for me and a show of gratitude to the members of the BSSH. You can see on the first slide there, your colleagues and members of the society who have submitted these questions for your pleasure for this quiz. So, without further ado, fingers on your buzzers. First starter for 10. What is the anomaly that's seen?
It's a Lindbergh-Comstock anomaly. Lindbergh described it in 1979.
Correct. 10 points. Okay, your first bonus questions to the Diplomats. Please pick 3 of these surgeons and name the place of birth. Come on, Diplomats. Can I have an answer? Today.
So will Dupont France?
No. We need the city.
Oh, we need more time.
Paris. I know he has a statue in Hotel Dieu in Paris.
No, so that's not right. Okay, it was Pierre Bouffay near Limoges, not 1777. Try another one.
Sterling Bernal.
Los Angeles.
San Francisco.
America.
One more.
Yes. And Madelung will be Belgium.
Madelung, Gotha, Germany. So no points there in the bonuses. Starter for 10. Yes. Name this famous radiologist who described the disorder that was
Kienbach.
Kienbach is correct. So level pegging. Your bonus questions are on Robert Kienbach. Where was he born? First question.
Going to say Vienna.
Correct. What year did he first describe lunatomalacia, or Kienbock's disease?
1921.
1910. What other disease process of the carpus did Kienbock describe in the same issue of the journal where he describes lunatomalacia?
Was that lunate or carpal?
What other... He described another disease process in the same journal.
In the carpus or in the lunate?
Oh, you didn't say.
In terms of the disease process.
Oh, right, okay, we didn't hear that.
Have a go. Let's have an answer.
Scaphoid non-union.
He described the pattern of carpal perilunate dislocation. Okay, next starter number 3. Which upper limb condition is referred to as the curse of McCrimmon's?
Dupuytren's disease.
That is correct. The McCrimmons held land from the clan of MacLeod of Skye. They themselves were of Norse descent and were musicians to the chieftains of this clan. They were recognised as preeminent amongst bagpipe players, and in the end of the 15th century, the 8th chief of MacLeod endowed a college of piping on Skye under the tutelage of McCrimmon. The McCrimmons were believed to have been cursed with this condition, which bent the little finger, the crewman curse, making the playing of bagpipes impossible, for the little finger of the right hand is singularly important in playing this instrument. Okay, bonus question for the Dons. It's on anatomy of the plexus. What structure lies superficial to the suprascapular ligament? That's the question. You're not going to get anything on the screen. Superficial to the suprascapular ligament.
The suprascapular artery.
Correct. The suprascapular nerve lies in the notch deep to the ligament and supplies which two muscles?
Supraspinatus and infraspinatus.
Correct. And what is the commonest cause of suprascapular nerve compression at the notch?
Carrying a heavy load.
Incorrect. Ganglion from the superior labrum of the glenohumeral joint.
Oh, yes.
You can debate that with
We will.
In our
So, starter
150
number
years,
4.
have we seen it?
Fingers and buzzers for starter number 4. Which German neurophysiologist first described paresthesia elicited by tapping over an injured nerve?
Tinel.
No.
No, Hoffman.
You've lost it. Well, they were incorrect. He interrupted, so I'm going to give you the full question. Which German neurophysiologist first described paresthesia elicited by tapping over an injured nerve in 1915, the same year the test was described by Jules Tinel in France, to whom it has become attributed?
It's Hoffman from Germany, and Tinel was
What was
French.
his first name? I'm joking.
Hoffman. Mr. Hoffman.
Paul Hoffman. Well done. So bonuses to the Diplomats. Okay, this is an MRI round. These are accessory muscles in the hand and wrist. Can you identify the structure with the arrow? Okay, let's have a go.
It's the accessory flexor pollicis longus called Ganser's muscle.
Correct. Incorrect. It's FCRB, or flexor carpi radialis brevis. Next one. This one here.
It's extensor digitorum brevis manus.
Correct. And 5 marks there. And the last one. Let's have it.
Yeah, palmaris brevis.
That's accessory palmaris longus. So 5 marks there, so you're on 15 now, or 25, sorry. And Dom's lost 5 points for the interruption. So let's get back to starter number 5. The question is as follows: name 4 muscles completely paralyzed in a C5 avulsion injury.
Oh, yeah, I have to answer.
Oh, you press the button.
So repeat it. Quick, can I have the question?
No, you're not
Yeah.
gonna have
So C5 avulsion or rupture?
C5 avulsion injury.
So C5 will supply the supraspinatus, the deltoid, the infraspinatus, and the musculocutaneous nerve, and the biceps.
That's incorrect.
Yeah.
Muscular.
Supraspinatus, infraspinatus, deltoid.
You said muscular. What did you say?
No, I was saying the muscle supply the musculocutaneous nerve.
Okay, right. So what was your final muscle?
So
Give me your final muscle.
suprascapular, infrascapular, supraspinatus, infraspinatus, deltoid, and the biceps.
And
And the biceps.
biceps is not there. So you could have taken any 4 of supraspinatus, infraspinatus, subclavius, deltoid, rhomboid, major and minor, teres minor, and levator scapulae. So we go back to another starter. Starter number 6. Fingers and buzzers, everyone. The long head of triceps nerve branch transfer to the anterior division of the axillary nerve was first described in 2003.
It's described by Somsak Leachman monks called Bangkok transfer.
Correct. Well done. No applause. Okay. Diplomats, your bonus questions are on French hand surgery. Name the odd one out and why.
So we know Dupuytren's, we know surgery, we know Raynaud's, we know
Ambrose Parry was the one who did the flying ambulances, and so he took blood to the front, and so was Dupuytren. So it wasn't really so much about surgery, although he did discover the front, putting the oral and everything into open branches.
Okay. Have a go.
Dupuytren's.
Dupuytren's is not the right answer. The answer is Mère Daubigny. He practiced at the Hospital of Cochin. The others all practice at the Hotel Dieu. So next question.
Technically, Ambrose Parry practiced in the medical forefront of the
Speak to the
military.
microphone.
I'm just saying, technically, Mr. Parry did all of his discoveries in the battlefields, to be technical.
Well, Mr. Who?
Ambrose Parry.
Okay. Well, that's the question. That's the question as it was written. By one mark. So, what are the next question? What are they famous for?
Dupuytren's for his Dupuytren's surgery.
Correct. What disease?
Raynaud's for the Raynaud's, both Raynaud's disease and Raynaud's phenomena,
Correct.
primary and second. Trosilocin is for the calcium metabolism.
Okay.
And
Daubigny?
I think pathologist, because I've seen the
No,
pathologist.
so he was the first president of the GEM, but he was also famous for the acrylic hip. So you don't get those points there. Final bonus, link the names of these past presidents of the GEM to the operation.
Yeah. Fouché was a lot of things. Okay. Kapanji is excision crystallina. And Livet.
What do you think about yours?
Yeah.
Excision?
Crystallina.
Yeah.
Okay, I'm gonna
Yeah,
Go for
I'd
it.
say start with Guy Fouché was bouquet osteosynthesis.
Correct.
1979. Claude Dufourmentel, he modified a rhomboid flap, but actually it's not rhomboid
Correct.
flap. Capangi was excision of distal ulna.
Correct.
And Professor Levé described the fractional lengthening for
Correct. So
muscle
you've got that
conjunction.
one right. So 5 marks there. Fingers and buzzers, everyone. Starter number 7. Which muscle is wasted in this clinical photograph?
Abductor pollicis brevis.
That is correct. Well done. Okay, bonuses to the diplomats on this image here. What is this condition?
Stop. It's got this is brachydactyly.
I'm going to hurry up now.
It's triphalangism. Is it triphalangism?
Let's have an answer.
Brachydactyly.
Correct. What
Which
type
type?
Sorry?
Which type?
Is it?
No.
If you start it right, you get the opportunity to answer. Do you know what type it is? Jill didn't write this question, by the way. What type is it?
Type B.
Type?
B.
B4? B4? Bravo.
Yeah.
Football. No, incorrect. It's type D. Which famous actress has this condition?
Megan Fox.
Correct. What famous fashion brand is she associated with?
Famous fashion brand.
Yeah, what brand is she?
Is that Armani?
Correct. Well done. So the scores are pretty close. 30 plays 55 or 60? 30 plays 60, okay.
Come on, right.
So,
Just wiping us out.
next starter. Which Romani French jazz guitarist and composer defied all odds to overcome severe burns to his left hand, sustained at the age of 18 in a house fire in 1928, to create one of the most distinctive instrumental styles in the 20th century music known as gypsy jazz?
Django Reinhardt.
Correct. Well done. Your bonuses are on international nerve surgeons. Which German surgeon first described the transfer of the radial nerve to the axillary nerve through the anterior approach in 1911? Have to hurry you. Have a guess. Nothing to lose.
Can't even think of a name.
Volkmann.
Sorry?
Volkmann.
Adolf Stoffel. Which Canadian-born nerve surgeon described a modification using the medial triceps nerve for transfer to axillary nerve in 2006? Canadian-born, 2006. Okay, let's have an answer.
Just pass. We need the time.
No, you have to answer.
No, you can pass.
Going to pass.
Susan McKinnon. Which South American surgeon re-described the original Stoffel procedure in 2007?
Zancoli.
Jane Bertelli. Okay, no points there. Back on the starters, we have 40 plays 60. Starter number 7. Which surgeon said the famous words, "Je le pensais, Dieu le guérit"? I will translate. I bandaged him and God healed him.
Parry.
Correct. Your questions, Dons, are on carpal coalitions. Can you put the following coalitions in order of frequency?
Lunate triquetrum.
It's got to be the commonest, isn't it?
Lunate triquetrum. Capitate trapezoid. No, capitohamate. Right. First is lunate triquetrum. Second, capitate hamate. Capitate trapezoid and scaphoid lunate.
Well done. Name 3 common sensory cells or structures found within carpal ligaments contributing to proprioception.
Can you repeat the question, please?
Name the 3 most common sensory cells or structures found within carpal ligaments which contribute towards wrist proprioception.
Golgi apparatus. Betuline corpuscle mountains. Bearing.
Let's have an answer.
What's the first one? Golgi apparatus.
Golgi is 1.
Yeah. Mechanoreceptors. Bare nerve endings.
Okay, so it's Ruffini, Pacini, and Golgi. So we'll move on to the next bonus, final bonus. How many dorsal extracarpal ligaments are there? And name them. Dorsal extracarpal ligaments.
Radio triquetral is 1.
It is the, yes, I'll give you that. Radio triquetral, correct, well done. That's it?
Oh,
that's
it. One.
Okay, so 60 plays 60, fingers on buzzers. Started with 10.
Is paralysis of FDP of the middle finger.
Sorry?
Rupture or paralysis of the FDP of the middle finger.
That is correct. Okay.
Well done.
Your reward is a bonus questions on hematology. A chromosome breakage test is used to confirm or refute a diagnosis of what?
Fanconi's anemia.
Correct. In sickle cell anemia, instead of normal hemoglobin type A, patients have a preponderance of what?
HBS.
Correct. Apixaban, also known as Eliquis, inhibits which factor in the clotting cascade to attenuate coagulation? Let's have an answer.
I can't remember which one it is.
Everyone in the audience knows this.
Especially Helen.
Let's have an answer, please.
Factor 8.
Factor 10A. So 2 out of 3 there. And we have now on the scores 80 plays 60. The Dons are in the lead. Fingers on buzzers. Starter number 11. Which doctor left his native country having been rejected by his own country's medical fraternity, but went on to develop a stitching technique that we still use today and win the Nobel Prize for Medicine?
Alexis Carroll.
Excellent. Well done. Your bonuses is a picture round. Name the person and, if you can, the diagnosis. Famous hands.
Yeah, she's definitely got wasted of all the small muscles, hasn't she?
Yeah, so it's going to be T1.
T1.
Let's have it.
Diagnosis T1 palsy.
Well, I need the name of the famous hand, the famous person. It's not written on the hand,
No.
Jeff.
I'm trying to read it.
No? This is Bake Off Queen Mary Berry,
Oh,
who has poliomyelitis. She suffered this at the age of 13
Okay.
and spent 3 months in hospital. Next picture.
You've misspelled whose.
Okay,
Again,
minus five for
for insolence. For insolence.
insolence. Okay, whose hand is it, and what's the diagnosis?
It's a cricketer. It's a cricketer. It's an umpire.
These are your questions, aren't they? You need to get your spelling checks. The culprit is in the audience. Okay, let's have an answer.
It's got a wrist in there.
It's a cricketer. We need to get the next question.
Cricketer. Yeah, an Indian cricketer.
Should go for Tendulkar. It's the only one I can think of.
Okay,
What's the diagnosis?
Tendulkar, the cricketer.
This is Billy Bowden, who suffers from rheumatoid arthritis, the famous crooked finger of doom from the New Zealand cricketer who turned umpire after developing rheumatoid at the age of 20. Your last famous hand in this round, whose hand is it, and what is the diagnosis?
Well, she's got transverse arrest, and it's the girl that presents on, used to be on, she does the weather now, doesn't she? But she used to be on children's CBBS. What's her name?
Oh, yes, she's on the weather.
She's a presenter on the CBBS. Oh, used to be. Now does the weather.
What's the diagnosis, Jill?
Transverse arrest.
Congenital transverse absence.
This is transverse arrest of forearm. However, you did not identify the person who indeed used to work at CBBC. It's Kerry Burnell, born in 1979, English actress, singer, and playwright, a children's author, and ex-TV presenter for CBBS. Okay, fingers on buzzers for the next starter. Too early. Oh, Mishra, yeah, diplomats.
This is in Venice.
The question has not been asked. -5 for the diplomats. That's not the question. -5 for the diplomats. Dons, feel free to answer at leisure. Which artist created the first sculpture to be placed in the Grand Canal, Venice, earlier this year?
Okay, so he did big things.
Let's have an answer. No?
Got to pass on that one, I'm afraid.
Lorenzo Quinn, who was highlighting climate change with his sculpture named Support. Fingers on buzzers for the next starter. And here goes. Name the book and the author. First published in 2001, this fiction book describing the story of Patrick Wallingford, an American journalist who, after his left hand was eaten by a lion, receives a hand transplant donated by a widow who then demands unorthodox visitation rights with the hand. This book became a #1 bestseller in the New York Times. The author previously achieved world fame with novels The Cider House Rules and The Water Method Man. No one taking that? Okay, I'm going to move it on. The author, the book was called The Fourth Hand, and the author was John Irving. Okay, next starter. Name the condition I'm about to describe, more common in Afro-Caribbean populations with an incidence of 1 in 100.
Ulnar polydactyly. Left finger polydactyly.
Excellent, well done. Ulnar polydactyly. More common in Afro-Caribbean populations with an incidence of 1 in 150, common in baby boys, autosomal dominant, affects both hands and feet. You've got the answer. So let's move on to bonuses, which are quotes. Can you give me the name of the person who wrote this quote? I'm going to speed you up because time is pressing.
Rolf Birch.
Incorrect. This quote was written by George Bonney in 1980.
No, Birch is the second author.
Well,
It is Bonney.
Speak to the hand.
Bonney and Birch, 1985 paper.
Take it up
George,
later.
George Bonney was
Bonney
one
is
of
the first author and Birch is the second author in this paper.
You ain't getting the marks. George Bonney was one of the most colourful personalities in orthopaedic surgery in recent times. He passed away in 2007. Between 1955 and 1984, he was an outstanding figure in the orthopaedic department at St Mary's in London. important facets of his career, his surgery with devotion to the peripheral nervous system, his labours in both in committees at St Mary's and the NHS, his contribution to the MDU, and his editing of the JBJS British. Okay, next quote. Who wrote this quote? Let's have it.
William Osler.
Correct. Sir William Osler, Canadian physician, one of the 4 founding professors of Johns Hopkins. He was the first to create modern-day residency programs with specialty training, described by some as the father of modern medicine. Next quote. Gray knows the answer, but he's not on this year's team.
Florence Nightingale.
Correct. Well done. Okay. Fingers and fingers. Very close. 90 plays 75. Starter number 15. My question is as follows: how does forearm rotation change with elbow flexion and extension? Anyone?
Is that part of Vivian Lee's, Professor Vivian Lee's paper and the...
How does forearm rotation change with elbow flexion and extension?
So as you come into full flexion, you're able to supinate more and then, to allow your hand to get to your mouth, whereas when you reach out in full extension.
Okay, maximum elbow flexion, supination, more pronation, and extension. I'll give you that. So, bonus to you. Your bonuses are on nervous eponyms. What is the eponym associated with an aberrant sensory nerve interconnection between the median and ulnar nerve at the common digital nerves in the hand?
It's Richikenu.
Incorrect. It's Burrittini anastomosis. That's it.
No.
What? Next one. What is the eponymous name for a motor interconnection between the deep branch of the ulnar nerve and the recurrent motor branch of the median nerve, providing ulnar innervation of thenar muscles?
Can you say it again?
What is the eponymous name for a motor interconnection between the deep branch of the ulnar nerve and the recurrent motor branch of the median nerve, providing ulnar innervation of the thenar muscles?
Are you talking about the innervation in the forearm or in the palm? That's the question, because in the palm it's Richikenu and in the forearm it's Martin Gruber.
Well, I'll give you that because the question was of the thenar muscles, but okay, fine. Richikenu, fair enough. Okay. What is the eponymous name, final one, for the motor interconnection between the ulnar nerve and the median nerve in the forearm, supplying motor innervation of the thenar muscles from the ulnar nerve?
Martin Gruber.
I've got here Marinacci anastomosis.
No, it's Martin Gruber.
Okay, let's move on to another starter.
Oh, come on.
Unpopular question there. What technique of reinforcing a central slit repair is analogous to the Scuderi flap used in quads tendon repair? No conferring. So that question's gone. The answer was a Snow's flap. You're not allowed to confer. That was
we didn't ask.
Snow's flap. So next question. Next starter. Starter number 17. Have a look at the image. My question is as follows. Approximately 5 minutes after inflation of your upper arm tourniquet, your patient starts to flex the wrist and MCPJs while simultaneously hyperextending the IPJs and adducting the fingers and thumb. This carpopedal spasm is involuntary and uncontrollable. What is the phenomena called, and which electrolyte deficiency will be detected?
Carpopedal spasm and it's hypercalcemia.
So who's... okay, I'll give you that. It's Trousseau with hypocalcemia. Well done.
I could have got.
Your bonuses are on the lumbricals. What is unusual about the origin and insertion of a lumbrical?
It's a muscle which originates from a tendon and inserts on the tendon.
Okay, next one. What condition related to tendon injury and lumbricals was first described by Atul Parks in 1971 JBJS?
Can you repeat the question again?
What condition related to tendon injury and lumbricals was described by Atul Parks? in the JBJS in 1971?
It's called lumbrical plus hand. When you have a tendon injury, the lumbrical retracts proximally.
Lumbrical plus finger. I'll give you that one. Name 2 causes of a lumbrical plus.
So lumbrical plus will get it in the amputation of the distal phalanx when the tendon is cut short, or the FTP avulsion injuries.
Okay, that's 2. Fine. So what's the scores now, please? Diplomats surge ahead with 115, plays Dons on 90. Next, fingers on buzzers. It's an image. Spot the diagnosis.
So we have a ptosis of the eye. But we can't see the meiosis, so we can't talk about whether the patient has got.
What's the diagnosis?
In hand, so it's Horner syndrome.
You're conferring now.
No, I'm not conferring.
I think you have a bit of help from your break.
You're biased now, Zaf. I'm not conferring. Everybody's watching.
The answer was Horner's.
I told Horner's.
Fingers on buzzers. Next question. Which condition did the writer and his protagonist of the...
Psoriasis.
Psoriasis is the correct answer. Well done. Which condition did the writer and the protagonist of the BBC TV series starring Michael Gambon as a mystery writer Philip E. Marlowe suffer from, which forced him to write his scripts with his pen tied to his fist? The answer was psoriatic arthritis. And Dennis Potter. So bonus questions are to go to the Dons. Their bonuses are on Madelung's. When was the deformity first described by Otto Madelung? Let's have an answer.
1926.
Sorry?
1926.
1878. Name the associated autosomal dominant form of mesomelic dwarfism that results in short stature secondary to shortening of the forearms and 4 legs, tibia and fibula.
Dyschondrosteosis.
Larry-Vile dyschondrosis.
Correct. A mutation in which gene has been found to be prevalent in patients with dyschondrosteosis and Madelung's deformity? Which gene?
SOX gene.
Correct. Well done. Fingers on buzzers. Start at 20. Which X-ray view was first described by Paul Robert in 1936?
It was the Robert's view for the PA for the AP of the thumb CMC.
Well done, correct. Okay, you're on the music round. So have a listen to this. You do not have to interrupt because it's all in a bonus. So here's the first song. I want you to name the song and the artist.
So the Beatles, what's the name of the song? I want to hold your hand.
That's the song. The last line. I want to hold your hand, and it's the famous Beatles.
Okay, next one.
They get a bonus man for singing.
Well volunteered.
Next song. Okay, let's have it.
It's GNR Guns N' Roses.
Lay Your Hands on Me, Bon Jovi. And your final one.
It's It's Ironic by Alanis Morissette.
Yeah.
Sorry, what is it?
Ironic by Alanis Morissette.
It's not. Sorry, you don't get that. It's Hand in My Pocket by Alanis Morissette. So only 5 marks. Let's fingers on buzzers. Okay, fingers on buzzers. Look at the picture, please. My question is as follows.
Le Monde.
Well done. Well done. I don't know how you knew what the question was, but the question was which newspaper was used in the original description of Froment's test, and the answer is Le Monde.
Wow.
So, well,
Very good.
and I can confirm he did not write that question. Okay, your bonuses are on the brachial plexus. What is the first motor branch? Listen carefully. What is the first motor branch from the lateral cord of the brachial plexus? You can confer, of course.
No, that's off the trunk. No, that's off the trunk. So it's lateral pectoral nerve.
The lateral pectoral nerve.
Correct. What is the first motor branch from the musculocutaneous nerve?
Nerve to coracobrachialis.
Well done. What is the third motor branch from the musculocutaneous nerve?
The brachialis.
Well done. All points there. Fingers on buzzers for the next starter. Here's the picture. Which country was Isidor Kessler from?
Israel.
That is incorrect. He was born in Bulgaria in 1926, but then did emigrate. So, next starter question.
Sorry.
You have Jeremy Rodriguez to thank for that one. Next starter question. What is the name? Next starter. Sorry. How many muscles are supplied by the superficial branch of the ulnar nerve? Number and names. Superficial branch of the ulnar nerve.
Five. 1, and it is something brevis. No, forget it.
Very close. So close, but so far. Palmaris brevis. But I'm not going to give you anything for that. 135 plays 130. Next starter question. -5.
No.
What is the answer to the question I've not asked?
Glomus
No,
tumor.
you said you can have a guess.
Have a guess then.
It's a glomus tumor.
That is not the answer. So, in your own time, and you can confer, what is the name of the AV shunt within the glomus body that is responsible for the thermoregulation of the digit?
It's cheating. It's cheating.
It's a very
The
serious
glomus
allocation.
body. The glomus body.
No.
You can't answer now.
Oh, you can answer it. This is a good part.
The answer is the suke hoye anastomosis. Next starter. Next starter. Fingers on buzzers, please. The safe dose in milligrams per kilogram for lignocaine with and without adrenaline is?
So,
No, you can't confer. Go on.
3 milligrams without, 7 milligrams with.
Well done, excellent. Okay, your bonuses are, can you name the following movie stars and their hand conditions?
yeah, I know. What's the name of the Star Trek actor? So first one on the left is Hrithik Roshan, Bollywood actor. Next one has got Dupont Bill Nye from Love Actually and Patrick Stewart from Star Trek.
What are their hand conditions?
So Hrithik Roshan.
Patrick Stewart has probably done more than Star Trek, but what are their hand conditions?
So Hrithik Roshan has got polydactyly of the thumb. Bill Nye has got Dupuytren's with severe contracture of his little and ring finger. And yeah.
What stage is his Jupiter? Oh, go on. What about the final?
Type 4. Stage 4.
Okay, I'm going to hurry you. Yes
And
or
Patrick
no?
Stewart will say peace sign for Star Trek.
Okay, so you get two out of 3 right there. show the next slide, and you can see their conditions there.
Osteoarthritis.
Duplicate thumb, Dupuytren's disease, and osteoarthritis. Patrick Stewart takes daily medical marijuana to control his symptoms. Next starter question. Have a look at the next image. Developed by Brigitte Rosen and Goran Lundberg in 1998, what is the full name of this tactile gnosis assessment tool? Is this a starter? Right, you're conferring. Let's move on. This was called a shape texture identification test. Please no conferring. Next starter, yep, is the next slide. There we go. No conferring. Put the following disease processes in the order that they were described by the individuals whose name they carry, with the oldest first.
So the oldest will be Dupuytren's disease. Madelung is the second. Kienbock is 1913 or 1867, and then Manifeld syndrome.
Excellent, well done. The years are wrong. You got it right. Dupuytren's 1832, Madelung's 1878, Kienbock's 1910, and Manifeld 1969. Your bonus questions. Your reward is sensory assessment. Question 1, what are the 3 levels in the sensory assessment hierarchy modified by Jarosh Harold in 2005? Okay, let's have it. We're running out of time.
It's static, moving 2-point discrimination, and they've classified from
Okay,
S1
that's
to
incorrect.
S4.
The answer is threshold localization object recognition. Question 2, if the shape texture identification tool, the STI tool, is an assessment of object recognition, give an example of a method of assessing localization.
Moving 2-point discrimination.
I'll give you that, 2-point discrimination. Question 3, on the same lines, give an example of a method of assessing sensory threshold.
So it's since Weinstein or the West.
Well done, okay. Fingers on buzzers, everybody. Next starter. Which will come to me. The next one. Starter 29. Can you do that? What part of the hand has the greatest proliferative activity?
Tips of the fingers?
I'm not going to give you that. It's the germinal matrix. And she didn't interrupt, so we move on to another starter, which is as follows. Which artery did the description of Jean-Claude Gamberto's flexor sliding system reconstruction utilize?
Jimmy described the blood vessels of the vincular architecture of the tendons.
That's not the answer I'm looking for. The answer I'm looking for is the ulnar artery perforator. Next starter question, number 31. A true lateral wrist radiograph is defined by the relationship between which 3 carpal bones?
Scaphoid, pisiform, and capitate.
Excellent, well done. Okay, your bonuses, as your diplomats are in the lead, 165 plays 135. Your bonuses are on wires. Who first used the K-wire for fracture fixation? Let's have an answer.
Kirshner?
Incorrect. It was actually Otto Louvier, 1932. Kirshner did first develop the wire, of course, but he didn't use it to fix fractures. Who described the use of a single interosseous wire loop to fix metacarpal shaft fractures in a series of 100 cases, achieving 100% union rate in transverse fractures?
It's Professor Al-Qatan.
It's Lister, 1978. And finally, in terms of size, when does a K-wire become a pin? In millimeters, please.
Yeah. How much?
Let's have it.
How much?
When does a K-wire become a pin?
3 millimeters.
2 millimeters, so that's incorrect. So let's move on. Okay, everybody, fingers on buzzers. Have a look at the image. What condition is this and what would be your concern?
It's got osteoarthritis.
That is incorrect. The answer is triple or velvet hand. And the concern would be malignancy, 90% of these cases. Moving on to the next starter. What do these two politicians have in common? Keep it polite.
Dupuytren's disease.
That is correct, Dupuytren's disease.
And they both had surgery whilst they were in office.
Very well done. You didn't write the question, but that is correct. Okay, your bonuses, diplomats are on tendons. Who first described no man's land?
Paul Burnell.
Sterling Burnell.
Sterling
I'll give you
Burnell,
that.
yeah.
Question 2. With regards to no man's land, what was Sterling Burnell's original reference comparing the Zone 2 Region 2?
Is he talking about where the insertion, like the actual spine zone 2? Because it's distal.
Flex a sheet.
Let's hurry you.
Flex a sheet. Flex a sheet.
Yeah, it's distal to yes.
Yeah.
Let's have it.
Distal is distal to yes, and then
Is the flexor sheath?
No,
Or
he
the
was
blue?
referring to in his original description the territory outside North London for no man's land. And the third part of your question is which tendon repair prevents gapping through compression?
Say it again.
Which tendon repair prevents gapping through compression?
It's locking sutures.
I've got here modified Keslow staggered repair, so I'm not going to give you that.
No, that's wrong.
Fingers on buzzers, please, for everybody. Next starter. What do a nautilus, a finger, and a mathematician from the Republic of Pisa have in common?
The Fibonacci series.
Excellent, well done. Next slide. Fibonacci 1175 to 1250 describe the Fibonacci sequence, and Littler's theorem, which is controversial, was that the hand would follow the same sequence. Okay, your bonuses, Dons, and it's pretty close. 135 plays 190 are on famous musicians and their hand conditions. Can you name them?
We just need to name the people.
Name the people, yes?
Right, Keith Richard on the left.
Correct?
That is Django Reinhardt, I think, in the middle.
Correct?
And
Have a go?
Let's win it.
let's just win it.
No idea.
I'm gonna call it then. No? So Keith Richards had OA, Django Reinhardt burn contraction. That was Glenn Frey with rheumatoid arthritis. And the scores currently, it was two out of three there.
2 out of 3?
Yeah.
Okay.
So 155 plays 190. Fingers on buzzers for this starter question. In recent years, a team from the University of Bristol analysed these hand stencils made by blowing paint onto the wall of what is to be the oldest known European cave art, dating back at least 40,800 years to the Paleolithic era. Controversy as to whether these paintings were created by Neanderthals or even female artists has sparked interest even in the Daily Mail. Can you name the paintings?
are they the Lascaux cave paintings?
This is the El Castillo cave in northern Spain. Next starter. There's an image I'm going to show you now. Have a look at these plaster slabs. These two plaster slabs are identical in length and width, but one has ridges that have double its thickness. How much stronger is the ridged plaster? Who's buzzed?
What you do? 3 times.
The answer is 3 times stronger. It's 8 times stronger based on the cube of the increase in thickness. So 2 to the power 3. And let's have your fingers on buzzers for the next starter. Okay. And?
Please do the gong.
155 plays 190. That's it. Well done, everyone. So, first and foremost, I'd like to say really well done to everybody who's taken part. It was very brave of you to put yourself forward to represent the dons of hand surgery and represent all those who are going through the BSSH diploma. I'm sure the creators of the diploma will be very pleased to see that the Diplomats have beaten the dons. 190 plays 155 in what was quite a close match. We'd like to invite the captain to take the prize.
I think the students winning the prize is a credit to the teachers who have taught us before. There's a very old Sanskrit saying that a teacher is known by when his student goes ahead of him. So that's what it is.
So, as is the tradition in this quiz show, it's goodbye from me, and goodbye from the Diplomats,
Goodbye.
and goodbye from the dons.
Goodbye.
Would you like to say a few words? Oh, Captain, would you like to say anything?
It was a jolly good competition. We all enjoyed it, and the best team won.
Coming. I hope you had a stimulating and entertaining day. I was terribly impressed by the widespread knowledge and speed of thought. I would have scored nothing, and will certainly not be going up here in the near future. So thank you very much, Zaf, for conceiving and delivering this, and those who supplied questions. Thank you also very much indeed for everyone who has attended and taught on today. There's a prize or award to give, which is for the best paper, and that was by best training paper, which will also be presented tomorrow morning. So whoever wins the prize can't drink too late tonight. And that's Michael Eldridge. And I would like to say a special thank you to the people who worked really hard to organise this, Jeremy Rodriguez, and deliver it on the day, Tim Davis and Donald Sammett. So thank you very much.